I'm Melissa Ponzio, and this is WebMD's Ask the Pharmacist. With McCary Weck-Marciniak, National Spokesperson for the American Pharmacist Association, Clinical Associate Professor at the UNC Eshelman School of Pharmacy, and practicing pharmacist. She's here to answer the most frequently asked pharmaceutical questions put to us by you, the WebMD community. We're talking about a prevalent issue in our society today, taking care of an elderly parent, with focus on medications, pain, mental health, and heart health. So we're going to get started with this question about medicine combinations. My elderly father just moved in with us, and I became aware of the medication he is taking. I wonder if his doctors know what all he is taking, and want to know if a pharmacist can help me make sure all of his medications are safe when taken together.
Yes. This is a really great opportunity for this person to sit down and talk with a pharmacist. And it's very common that once we get older, we're taking more and more prescription medications and even over-the-counter medications or herbal products and dietary supplements. And our care is usually being managed by multiple healthcare professionals. You may have a generalist and a number of other specialists that you're seeing. So I would recommend that this person visit their pharmacy, and they can come in with their parent and come in themselves and go over everything that they're taking together with the pharmacist. Bring in all of those prescriptions and over-the-counter products and dietary supplements, and we're going to do what's called medication therapy management. And it's what pharmacists are trained to do and we do every day. It's going through everything that you take, making sure that they're the best options for you, and making sure that they don't interact, or if there's anything that we could change and maybe have something be less costly for you but just as effective, we'll talk with your doctor who's managing your care to make sure that that's a good choice for you. So I think this would be a great opportunity. We can do this at least once a year and kind of check in and see how things go, or even multiple times throughout the year, because often, as happens with our elderly parents, sometimes they get sick and they're in the doctor's office, they have infections, maybe they get hospitalized. And so as we transition from different healthcare settings, it's a great time to recheck in and make sure that we're all on the same page about everything that we're taking. And that's what we do as a part of those medication therapy management visits. We go over everything and we communicate with all the different practitioners who are managing your care.
When an 84-year-old woman loses 10 or more pounds and an 85-year-old male on Coumadin loses 25 pounds or more, should their medication dosages be changed?
So I think the first thing I would ask is this weight loss intentional or unintentional? It's possible that these two individuals are trying to lose weight together and have done so successfully, and that would be a good thing. But if it's unintentional, there's a little bit of concern there as to why they've lost so much weight. Now, in general, Coumadin is a medication that's used to thin out our blood. It is a medication that needs to be monitored very frequently, and we do check blood levels to be sure that it's at the appropriate amount to not only be effective, but also safe. Now, in general, if you've lost weight, we may not necessarily need to change the doses of this medicine, but that weight loss may indicate something else is going on, and that could affect the blood levels of this medication. So someone who's on Coumadin gets regular monitoring, and I'd want to be sure that they are getting this monitoring to make sure that their dose is still appropriate for them.
My father takes Metformin 500 milligram tablets and has noticed the pill still in its whole form in his stool. Should we be concerned?
This doesn't sound like something that's normal to me. I'm not aware that this would be something that would commonly occur. So I think in this case, I would contact the person's primary care provider and let them know. This isn't something that's commonly reported, so I'd want to check into that and be sure that there's not something more serious going on.
Okay. My 85-year-old father is taking Tramadol 3 times a day along with other medicines. He has been nauseous every morning as well as some evenings and sometimes actually vomits and feels weak. Could this be due to the Tramadol?
So Tramadol is a prescription pain reliever, and one of its side effects could be nausea and vomiting. So that does happen, and it could be that this is related to the medication. He could try taking the medication with a little bit of food. That might make it a little bit easier for him to stomach. But if we find this is continuing to happen, then we may want to look at some other alternatives to help manage this person's pain.
My 76-year-old mother has been prescribed morphine tabs for pain caused by deteriorating hips and a prosthetic knee. Respiratory problems are preventing further surgery. She wants to know if she could become addicted to the morphine.
Well, addiction is something that's definitely on the minds of lots of individuals, and it's come up a lot in conjunction with prescription pain relievers. And these prescription pain relievers are okay to use, and particularly when these people have pain, they need to follow the directions as prescribed. And just because you use this medication as prescribed doesn't mean that you will become addicted. Not everyone may become addicted to medications. So I would want to be sure that we're monitoring this individual to make sure that they're using the medication as prescribed and that it's working well for their pain. And if there's any concerns that maybe there's some some abuse going on or it's not working appropriately for them, then we can talk with their primary care provider or the person managing their pain to maybe see if there's another alternative that we can move to.
My 76-year-old dad is suffering from shingles on his forehead and eye, and an ER doctor prescribed 7.5 milligrams of hydrocodone every hour as needed. After 4 hours, my father experienced some hallucinations. Is it really safe to take this much hydrocodone?
This is not a good scenario if this is correct as is being relayed to us. So first off, shingles is a condition that is extremely painful. So certainly this person may need some pain medications to get them through this time. The medication that's prescribed is at a relatively high dosage and typically might only be prescribed every 4 to 6 hours. So if this person is using 7.5 milligrams every hour, that is probably way too much medication, particularly for a senior. And when we take it in high doses, it could cause some things like hallucinations or kind of having that disconnected type of feeling. So it's possible that the symptoms this person is experiencing may have come from taking too much of this medication. In this case, I would probably try to either talk to the emergency room doctor, though that may be difficult, or going back to talk to the primary care provider so that we can prescribe a better medication to handle this person's pain. And kind of note, I do talk and work with a lot of seniors, and shingles is a common condition as we get older. It can happen, and it's very painful when it does. And there's a new vaccine that's come on the market just in the last few years that helps prevent against shingles. And it's approved for anybody who's 50 years of age and older now. That's very new. It used to be 60 and older. Now it just recently got changed to 50 and older. So in general, this might be a good option for people to prevent having this problem that this individual did, to get that vaccine ahead of time. And it's a one-time dose that you can get in your lifetime. And even if you've had a prior episodes of shingles, you can get another dose of that vaccine. So once this person's shingles episode resolves, they could go get the vaccine to hopefully prevent against having another episode again in the future.
Okay, great tip. My dad, who was taking hydrocodone 3 times a day, was just prescribed Exalgo 8 milligrams. Is this okay?
So Exalgo is another type of prescription medication that's very similar to the hydrocodone. It would not usually be appropriate for somebody to be taking these both together. So I would want to check back with a doctor who prescribed this. I'm not sure if it's the same person for both of these medications, but likely it was meant that he would stop the first one and then start taking the second one. So I'd want to check to be sure this is the case. They should not be used together.
Okay. My 95-year-old mother only weighs 108 pounds and has been on 100 milligrams of bupropion for the last 10 months. Is that dosage too high for her age and size? Should I ask the doctor to review the prescription?
This would be an appropriate dose of bupropion for an individual. 100 milligrams is actually sort of on the lower side of the dosing range, so it would be appropriate even considering this person's age and their weight. I'm going to assume that they're probably using this medication for depression or some mood issues, in which case this would be an appropriate dose to both treat that problem, but also to be safe for this person.
My 89-year-old mother, living in a nursing home, has been taking Celexa for about a month with Ativan as needed. They stopped giving her Ativan and started Trazodone and Depakote. Is there a possibility of an interaction with the Celexa?
So this individual is now taking Celexa, Trazodone, and Depakote. Celexa is an antidepressant medication. It can be used for depression and also some signs of anxiety. Trazodone is also an antidepressant, but it's from a different class of medications. Celexa and Trazodone can be used together. Often people will take Celexa in the morning and maybe a Trazodone at night, as Trazodone can also help people get to sleep. Now, sometimes taking these two medications together can increase levels of a hormone in your body called serotonin. And some signs that maybe you have too much in your system could be that you're getting agitated or maybe have tremors or diarrhea. And it's a very rare side effect that could occur. But we would like to keep monitoring this individual to be sure that they don't have any of those side effects.
And what about the Depakote?
Completely fine to take the Depakote with the Celexa and the Trazodone.
Okay. My 93-year-old mother is taking 12.5 milligrams of aldactone, 40 milligrams of Lasix morning and night, and 2.5 milligrams of lisinopril in the morning. Could the aldactone be causing a very low blood pressure drop?
So these medications are often used in combination together, particularly in individuals with heart failure. Aldactone is also known by its generic name spironolactone, and it's a diuretic. Lasix is also known by its generic name furosemide. It's also a diuretic, but from a different class. And lisinopril is a medication for blood pressure. All three of these medications, though, can lower blood pressure. So it could be due to the aldactone, but it could be due to the Lasix or the lisinopril. Now, also important to point out is that aldactone can increase levels of potassium, as can the lisinopril. So for someone who's on all three of these medications, we would want to make sure that they have regular laboratory monitoring, which could include potassium, but also some things like serum creatinine, which measures their kidney function, and also having their blood pressure checked. So it's possible that any one of these three medications could be causing a drop in blood pressure.
My elderly father's cardiologist added 40 milligrams of Crestor when my father is already taking 80 milligrams of simvastatin. I was under the impression these medications were similar. Are they safe to take together?
Well, this person is correct that these medications are similar. Crestor is a brand name product that's relatively new to the market, and its generic name is rosuvastatin. It is in the same class of medications as simvastatin. These are the statin medications that are often used to help people lower cholesterol. And you would not be on both of these medications together. What often happens is that the simvastatin might need to be increased in dose, and so likely the prescriber is wanting to change to Crestor, but we would discontinue the simvastatin. So I think this individual should check with the primary care provider to be sure that that's what they intended. Because generally, if you need more help with your cholesterol, we would add medications from a different class. We certainly would not use both of these statin medications together.
My mother was on Amlodipine, and it made her legs swell and leak severely. Her physician discontinued the medication immediately. How long will it take for the swelling to go down?
Well, amlodipine is a blood pressure medication of a class called a calcium channel blocker, and it can have an adverse effect of peripheral edema, which means swelling in the legs. Now, the part about leaking severely doesn't kind of sound correct to me, but perhaps maybe that's how they're describing the leg swelling. So amlodipine can have this side effect, and it's often dose-related, that the higher the dose is, the more likely this is to occur. So it was good that they stopped this medication. It may take about a week or 2 weeks to see this resolve completely. Now, it's possible then that they'll still need something to manage blood pressure, and they may choose a medication from a different class, but it's possible they could restart this medication at a lower dose and see if it does cause this problem again. But it will probably take about a week or 2 weeks to resolve entirely.
My grandfather is in his 70s and started taking Plavix about 4 months ago. Within the last 2 weeks, he found blood in his urine. Could the Plavix be causing this?
Blood in your urine is a very scary symptom, and that's definitely something that needs to be evaluated by this person's primary care provider. Plavix is a medication that helps to thin out the blood, and so it is possible that some of this bleeding could be due to the medication. But it's also possible it could be due to something else, another medical condition that's going on, or another medication in this person's profile. So this is definitely something that needs to be evaluated by a primary care provider so we can ensure what is actually causing this symptom and help it to resolve.
Can baby powder be used on an elderly parent with congestive heart failure?
This is a kind of a different question. I'm guessing that the reason this person is asking is just maybe a concern about aspirating baby powder, some kind of talc. So in general, there's no restrictions for using baby powder with someone who has heart failure. But as with anybody who's using baby powder, you would want to keep it out of their respiratory area so that they don't have a risk of inhaling it. That wouldn't be good for anyone. But there's no particular risks for somebody who has heart failure and who needs to use baby powder. But likely would just try to keep it away from their respiratory area so they don't inhale it.
My 94-year-old mother is taking generic Bactrim for a urinary infection. She also routinely takes digoxin. After a week of taking Bactrim, she is exhausted and unstable. Could this be caused by an interaction of the two drugs?
So generally somebody who's unstable or not feeling well wouldn't be due probably to a drug interaction here. Now it's possible if this person has an infection that it could be the infection itself that's causing them to sort of not feel themselves and not perform to the best of their ability. But digoxin is also one of those narrow therapeutic index drugs, which means we need to monitor it very closely to make sure we have the right levels in our body. And there is no drug interaction between the Bactrim or the digoxin, but in general we do want to make sure we monitor other things when you're on digoxin, like your sodium, your potassium, and your kidney function. And so we might want to check some of those things out to be sure that that medication is working as it should be and not at that it is at an appropriate level. But it probably is not a drug interaction that's causing some of the symptoms here.